Good morning and welcome. My name is Wade Norwood and I am the CEO of Common Ground Health, which is the health planning entity for the 9-county Finger Lakes region. And I would just begin by a confession of how very wonderful it is to be here and to see you of all. I have been starved for social contact, and so even doing a press event gives me an opportunity to at least elbow bump if I can't hug. As our outdoor location, and as everyone's masks remind us, these are extraordinary times. And extraordinary times demand extraordinary responses. And I'm delighted to join with my colleagues here in announcing one such response, and that is a new regional task force that is helping the entire 13-county region navigate the exceedingly complex task of reopening schools. It's an assignment that requires us to bring together health and education. And as someone who stands before you, not only leading a health planning entity, but also serving as a New York State region, I am very well versed in bringing together health and education, and very much aware of the incredible power that exists at the nexus of our incredible community of educators and healthcare professionals. And so I am proud that Common Ground Health is helping convene the Finger Lakes Reopening Schools Safely Task Force. This collaborative effort brings together professionals and parents from across our region, leaders from public health, healthcare, education, government, and our not-for-profit sector, who are all working together to make sure that students and their families and our educational professionals are protected in body and in mind as we reopen schools during these very unprecedented times. If safety is our charge, equity is our guiding principle. The task force is committed to supporting all students, including those with special needs, with fewer resources and limited access to the internet. So my delight is to introduce the following speakers who will approach the podium behind me. First, Bello, our Monroe County executive, who will talk more about why this task force was formed. He has been tireless in finding ways to meet the challenge of the coronavirus, and the task force is a prime example of his innovative and collaborative approach to governance. He will be followed by Dr. Mike Mendoza, the Commissioner of Public Health for Monroe County. And Mike is a man who does not need introduction because he has hardly had time to catch his breath, as he has been a reliable, meaningful, and trusted voice and face for this community as it has met the challenges of the pandemic. This is very fascinating and something equally unprecedented, that the podium has just collapsed and taken my papers down with it. Amy, do you have my script copy for me, please? This is for a man who's used to banging the podium on a Sunday morning, and I'm delighted I wasn't banging on it when it dropped and the cameras caught that. After Dr. Mendoza, our next speaker will be Leslie Meyer Small, the Superintendent of the Rochester City School District. Because Leslie has a long history as a member of this community, we knew that she would hit the ground running when she took over the RCSD this year. But because of COVID-19, her early tenure has turned into both a sprint and a marathon. She will be followed by Joanne Antonacy, the District Superintendent of Monroe II, Orleans, BOCES. And she will talk about some of the issues that are facing schools across the region. Thereafter, you will hear from Vicki Swinehart, a very dear friend of this community as the public health director of Seneca County. And she will share more about the role the task force will play in bringing the public health and the education spheres together. And then the final speaker will be Maria Cruz, who is a parent leader on the task force and a family peer advocate. And I would ask that you allow her to be your conduit by which we share information about the task force and its guiding principles in Spanish. After those speakers, I'll come back with a few concluding remarks, and then we'll open the floor for questions that you all may have. Adam?
Thank you, Wade. And let me see real quick. Well, thank you, my friend Wade Norwood from Common Ground Health. I can't thank him enough for stepping forward and supporting this effort to bring people together to collaborate on an issue that is critically important to so many families across our community, our county, our region, and our state. So I want to thank Wade for his support and for all of his team at Common Ground Health. I also want to acknowledge my Public Health Commissioner, Dr. Michael Mendoza. I say my public health, our Public Health Commissioner, Dr. Michael Mendoza, for his just outstanding leadership and dedication to protecting and keeping this community safe. He's done a fantastic job. Dr. Leslie Meyer Small, in some ways, we're going through this together. We're building a plane as we fly it. New to our organizations this year in the face of a pandemic, but thank you for your partnership. Joanne Antonacy and all the school superintendents and the support of BOCES. Vicki, who I get to see on Zoom calls, but first time in person, it's really good to be with you and for your work keeping your community safe. And of course, Maria Cruz, a parent whose voice we really do need to have as we go through this reopening of our schools. You know, I want to say it's hard to believe that it's been nearly 6 months since the first case of COVID-19 was announced in Monroe County. And in the days that followed, we had to make difficult decisions. And one of those difficult decisions was to close our schools for the foreseeable future. And since that time, we've asked the residents of our community to change in ways that we never could have anticipated. Working from home, learning from home, and social distancing have become part of our new normal. Wearing a face covering like this in public has become second nature, and seeing friends and family and colleagues over Zoom or FaceTime is now a regular occurrence. When I was running for county executive just last year, I talked about our community operating in a new paradigm that would bring various organizations and demographics together for the benefit of everyone. Instead of operating in silos, we would bring people together to share ideas, to listen to each other, and to find solutions to problems that exist across our community. And while this was one of my top priorities, I certainly didn't expect that this probably once-in-a-lifetime pandemic would help initiate that change and provide that catalyst. But that's exactly what happened since the outbreak of COVID-19. Throughout this crisis, Dr. Mendoza and I helped to bring our world-class hospital systems, Rochester Regional Health and the University of Rochester Medical Center, together, competing medical systems together, so that we could have a coordinated response to any potential outbreak or spike to the disease here. We worked with other government officials, elected leaders, and first responders to develop different initiatives, improve outreach, communication with the community, and maintain those open lines. We partnered with our municipal governments to distribute over 3 million face coverings to the public and have held similar distributions with our local barbershops, beauty salons, restaurants, and other small businesses to ensure that they have the PPE required to open safely. And now, we're taking that next step by bringing together school leaders, educators, healthcare experts, and public health officials to ensure the safety and well-being of students, teachers, staff, and families with the anticipated reopening of schools this fall, because keeping them safe is our top priority. While many school districts are still finalizing their plans to reopen in the fall, and others are awaiting state approval for their proposals, the Finger Lakes Reopening Schools Safely Task Force has been working together to develop ideas, identify needs, and share best practices in anticipation. We know this is a long-term process, and that COVID-19 pandemic can rapidly change or uproot plans or ideas in an instant. So this task force will provide an ongoing forum to solve issues and answer questions as we collectively navigate this new reality. As a father of 2 school-aged children and a husband of an educator, my family too is anxious, like many families across Monroe County, for the schools to reopen. But what we want is that sense of normalcy. We want our children to be able to go back to school. We want to get back into that routine, and we want our kids to be educated. But if we are going to do that, even on a hybrid basis and the different plans that are coming out, it is critical and necessary that we are smart about it and that it's done safely so that the public health of our community remains at the forefront and is not jeopardized by any potential outbreak, and that spreads are kept to a minimum. Because the reality that COVID-19 is not going away anytime soon. But if we all work together as a community in the same way that we have been working together over the last several months, by bringing people together, by collaborating, by working together and not working in silos, but understanding that the impact of COVID-19 in our community impacts all of us in many different ways. By bringing people together, sharing resources, leveraging resources, and sharing those ideas, we will keep our children safe and be able to open up safely, and so that parents have confidence. Because we have to make sure that parents, students, faculty, administrators, and the community has confidence in the plans as we go forward. Because like I said, we all want our kids to be able to go back to school. We all want to get back to a sense of normalcy, but we also have to do it safely. And that's what this task force is all about. So again, I want to thank Wade Norwood, his team at Common Ground, Dr. Mendoza, all of the school superintendents who I've had really the privilege, been delighted to be working with them over the last several months, administrators, teachers, and of course parents in our community for participating in the task force. I want to thank them for working together and thank them for keeping the health and well-being of our community at the forefront of their minds as we navigate this challenge. Next up to the podium, I'm going to invite an individual again who I've had the pleasure of working with hand in hand over the last several months, again to keep this community safe, to get the information out to the public as we need it, and I think it's just done a fantastic job, and that job's been reflected in our numbers here in our community and how well we've done in Monroe County managing this pandemic, and that's Dr. Michael Mendoza.
Dr. Mendoza.
Good afternoon, and thank you for being with us here today as we announce this critical support system for our public, private, and charter schools throughout the region of Finger Lakes. I want to start by recognizing every school teacher, every staff member, every principal, and every superintendent in our community. Educating our students is hard, even under the best of circumstances. And now you are facing an unimaginable challenge of teaching our children in the midst of a pandemic. So on behalf of a grateful community, thank you. I've been in touch with many of our school superintendents over the last several months, and I'm amazed by your dedication, your hard work, your long hours, your passion for education, and your genuine desire to do what is right for our students, our teachers, and our community in spite of evolving scientific evidence. I want to be clear. I believe our schools are doing the absolute best they can given these unprecedented circumstances. I also want to thank our parents and students for your patience and for your input. I've heard a wide range of concerns, and as a parent, I share your goal of reopening schools, assuming we can do so safely with the health and safety of our community at the forefront. And I realize that there are still many unknowns, and that there is still uncertainty and anxiety across our community, among parents, among students, among educators alike. Make no mistake, these are difficult times. Closing our schools was relatively easy. Reopening will be difficult, and the greatest challenge is yet to come. And I want to let you know that the Finger Lakes Reopening Schools Safely Task Force is here to help. The CDC and the New York State Department of Health have provided solid guidance about how to reopen our schools, and yet there remain so many questions about how to actually do this. How can we open our schools in a way that best protects our students, our families, and our educators? What happens if and when there is a positive case in our schools? How can we optimize education in these unfamiliar circumstances? And the list of questions will continue to grow as we strive to keep our schools open. I believe many of the answers will be found right here, among us in our community, as we follow the data and evaluate the state and federal guidelines and apply them to our local community. and ultimately, we hold the keys to our own success. We must continue to follow the latest guidance. We must test, trace, and isolate as appropriate, and in many cases even more so as our schools reopen. We need to wear our masks and be mindful about social distancing. Because of all of our cooperation to date, our numbers are among the best in the state, if not the nation. And we are not out of the woods, not even close. While there is still much uncertainty about how to reopen schools, there will be no uncertainty in needing to close schools if we see another surge here in our community. As we enter this new chapter in the COVID story, this task force will help unify our response to the immense challenges our schools and our community now face. The task force will serve as a space for ongoing dialogue about what is working and what is not working and what needs to be readjusted. It will consolidate and interpret medical and public health guidance to help schools make informed and science-based choices. And it will provide a strong and trusted voice if we find the need to call for policy or behavioral changes. So again, I want to thank our county executive, Regent Norwood, all of my colleagues up here on stage for all of their tireless effort over the last many months. Thank you to the task force members, and most importantly, thank you to the parents and students of this community. And with that, I want to turn the podium over to a new neighbor in our community, Superintendent Meyer.
Good afternoon. Superintendents, when they take the helm of a school district, are certainly responsible for a myriad of things. We need to ensure that the education that we're providing for students certainly help them to meet or exceed expectations. We're required to put policies, regulations, and procedures in place that ensure that they are safe and that protect them. We're responsible for their social emotional learning as well. We're responsible for making sure that we make sure they get to school safely, and that we are doing everything that we can to make sure that when they get to graduation, that they are ready to take and make that next step past post-secondary world. Mid-March happened and we had a global pandemic. COVID-19 was a major situation, certainly, that impacted Monroe County, and that certainly impacted schools across the county, the state, and the country. So that responsibility shifted to, before it was teaching and learning, overnight we needed to ensure that we provided resources for students so that they could learn meaningfully in a remote situation. We needed to continue to pay attention to their social emotional needs, because now they're not able to come to school and to have interactions with adults or with their peers. And so how do we maintain those relationships and those connections? In the Rochester City School District, each week we provided around 23,000 to 25,000 meals for students Monday through Friday. So nutrition is something that was not exempt from what we needed to do. Now we face the daunting task of reopening safely. And I am so grateful that I had the opportunity to sit at the table to represent education, to represent the superintendency, and specifically to represent an urban school district, which we know that some of those needs are great and they're vast. So having a team of experts outside of my wheelhouse, I have quickly become a Jill of all trades, and I'm learning to master many of those things. But to have a panel of experts, critical friends, phone of friends, or Zoom of friends, where you can have conversations and ask those critical questions. Just like parents, just like our staff, we are very concerned, and we want to make sure that those plans, when we submit them to the New York State Education Department no later than tomorrow, that we've made the best decision possible. And so I stand before all of you grateful for the opportunity to collaborate with partners who have expertise that goes beyond that, what I have, and to certainly contribute to the conversation as well. So I'm very grateful to have had this opportunity and to participate actively in helping to ensure that whatever school looks like in September, that it is done in the most safe manner possible. I will now turn the podium over to my esteemed colleague, Joanne Antonacy.
So thank you for the opportunity to speak this afternoon. There are 9 joint management teams across the New York State, and a joint management team is made up of multiple BOCES. In our particular region, our Midwest joint management team is made up of the Genesee Valley, the Monroe 1, the Monroe 2 Orleans, and the Wayne Finger Lakes BOCES. All of those BOCES serving 66 school districts. So this particular task force is far-reaching. Each of our DSs are serving on the Finger Lakes Reopening Task Force. The pandemic has established very complex challenges for school districts, for our students, for our families, and our communities. The paramount focus is to ensure the health and safety of everyone in our schools, all students, all staff. School districts and BOCES have taken on a thoughtful and a collaborative approach to the reopening of our schools. Urban, suburban, rural districts are all wrestling with many of the same issues, although some in different contexts. School leaders are working to keep equity at the forefront as we problem solve to meet these challenges head on. The Finger Lakes Reopening Task Force has brought many resources together to develop guidance that will instill confidence in and support for our reopening plans. It is through these vital partnerships that we will be able to support all students and all families during these uncertain times. Together we will keep education strong. Together we will take care of our students, our families, and our communities. Thank you. And now, my colleague, Vicki Swinehart. Vicki?
Thank you very much. Dr. Mendoza said that it was not an easy decision to close schools. A lot went into it, and even more goes into the reopening schools because there is so much at stake here. We have to keep in mind through this task force, it really brought home to me, all school districts are different. All schools are unique in what their resources are and what their needs are. This collaborative effort just brought so much information to light, and we had great discussion. It is so critical at this time because of the pandemic to bring together public health, educational professionals, and family. It is very critical to have the family input and the students' input into this. The group was able to come together. We talked about sharing resources on a regional basis. Ultimately, we want to provide a regional consistency with our recommendations, understanding that these recommendations are very likely to change over the course of the next few weeks or months, but our ultimate goal is to safely reopen our schools throughout. I was honored when I was asked to be part of this committee. I was very thankful. I was humbled. I don't feel I brought as much to the committee as I am taking away from the committee. I was able to give a little bit of the rural perspective on it, but I thank you for the opportunity, and it is ongoing, as I say, so I thank you all for the opportunity, and I think we've learned a lot and we've accomplished a lot, but we have more to do. But thank you. And I will turn it over to Maria Cruz.
Buenas tardes, el mensaje es para mi comunidad hispana. Acerca del grupo de trabajo de Finger Lakes, convocado por Common Ground Health, el grupo de trabajo es un consorcio de más de 40 profesionales de la salud pública, atención médica y salud mental, educadores y padres de distritos escolares de la ciudad, suburbios y rurales, en toda la región de 13 condados de Finger Lake, que incluye los condados de Allegheny, Chemung, Genesee, Livingston, Monroe, Ontario, Orleans, Schuyler, Seneca, Steuben, Wayne, Wyoming y Yates. El objetivo del grupo de trabajo es brindar apoyo a los estudiantes, sus familias, profesionales de la educación y la comunidad en nuestra región y ayudarlos a comprender e implementar orientación existente, identificar dónde se necesita orientación adicional y ayudar a proporcionar soluciones que mantendrán los estudiantes y al personal seguro. Al enfatizar la equidad para todos nuestros estudiantes, el grupo de trabajo servirá como un lugar para el diálogo honesto sobre los desafíos de evolución que experimentaremos. Nos guiaremos por los últimos descubrimientos científicos sobre el COVID-19, junto con la sabiduría y las experiencias combinadas de familias, profesionales de la salud pública, la salud mental y la educación. Aumentaremos la claridad, la certeza y la confianza al proporcionar información y análisis de manera transparente y accesible. siempre tendremos en cuenta el hecho de que las decisiones individuales y de colaboración que tenemos en los próximos meses tendrán un profundo impacto en nuestra generación más joven. Le debemos un mejor esfuerzo. Gracias y que pasen buenas tardes.
Thank you, Maria. And I really want to also thank Mike Mendoza for being here when the top fell out on him to prove that it was not just me. And I want to make it very clear that I am not afraid of the bottom falling out as long as this community remembers how to collaborate, how to partner, and how to use data to come together to form meaningful action plans. And so I thank my colleagues for being here this morning because they really represent the more than 40 professionals and parents who are serving on the school's reopening task force and making sure that we continue that tradition despite the unprecedented nature of the times. Our children's next year will be shaped by the choices, my friends, that we make. And so we stand here as a task force committing ourselves to making sure that we make the wisest and best choices possible to, notwithstanding the challenge we face, hand them a future that is not only not less, but more beautiful than the one that was given to us, because our children deserve no less. And so I open the floor now for any questions that you might have of those who are here with us. However, I do want to remind you that our purpose here is not to discuss any specific school reopening plan. Those plans and those details are being created by individual districts and should be more appropriately handled by the true superstars who are showing why the word super is in their title, the superintendents of our school districts. With that, are there any questions about the task force? Here, and then I'll come over here. Vicki?
Well, I think there's a lot of, obviously a lot of similarities. There's a lot of things that we have to do, but you have a little more resources in the rural communities, or maybe not as much. And even just if you want to focus on one issue, busing. It's a little bit of a different configuration in the rural counties. The children may be on the buses for a longer period of time. So you may need to take into consideration how many children you leave on a bus at that time, or how many children are bused out of the county for services that they receive, that in Monroe County they may stay in the county. So we have some lack of resources and different challenges. Small school districts have just more challenges that way. And working together, I will say for Seneca County, I can speak for that specifically because I'm more involved with that, our school districts worked very well together. And from the beginning of this crisis up till now and continuing, we have even gotten closer, if you want to say that, because we've had more frequent conversations and we don't hesitate to pick up the phone and bounce something off each other. I'm sure that's happening in the bigger counties too. I can't say that it's not, but it's just a little bit different in the smaller counties. It's just resources are probably our biggest issue. And we just work together. We have to, just like Wade said, you have to bring everybody together and you have to brainstorm to come up with the best answers to questions. And they may not be perfect, but that's what we can deal with right now until we can change the circumstances. Okay.
Thank you, Vicki. Jim?
Next question for Dr. Mendoza. This is a group that is highly interested in letting data and science lead its recommendations and the information that it provides. Would you say then that the mission is much more to move districts towards that information when it's time to perhaps shut down or withdraw, reduce, or to keep them open in the other fashion?
Well, the beauty of science is that it's a skill that we all learn as scientists in our training, gathering data, interpreting data, making meaning out of the data. But what makes this problem unique is that the meaning in those data are different, depending on the district, depending on the circumstances, depending on the communities. And so while it might be easy to say these are the recommendations, they're simply just that. And we need to work in partnership with our school districts, ultimately our parents and our families, to figure out what among those data makes the most sense. And that is the challenge. If this was purely a scientific problem, we wouldn't need this level of collaboration. But because it's so complicated, we do need this collaboration because there's no single way to interpret some of these data.
Are you finding districts arriving to this gathering, this conversation, with different thresholds about what they want to accomplish and what their emergency shoots really are?
Yeah, and that's appropriate because different communities have different perspectives and different needs and different tolerances for risks and ultimately different people. And so we've got to look at each community in a different way because what ultimately will work will be the science and data-driven approach that makes the most sense for them.
Yes, please.
Sorry, Dr. Mendoza again. Is there going to be, if a student or a teacher tests positive, is there going to be a set protocol across all the districts, or will it be separate?
So if and when there is a positive case, be it a student, a staff member, or a teacher in a school, the first step is to involve the local health department, be it Monroe County or whatever county it's in. And then we undertake the same process that we've undertaken to date, which is to investigate very thoroughly, identify anybody who might be at risk going forward, who may have been exposed to that individual, and then go back in time to figure out how that individual might have contracted that infection. Because of that, because the permutations of all of those different interactions will be different, there cannot be one single approach to any particular school or any particular district, other than to say that the health department has to be involved in making any of those decisions.
Patty, please, and then we'll come back.
Give an example of how the task force would react if the science changes and if there's an outbreak in the community. We're talking about diversity, but it seems like we also want to kind of march along with the same plan. So can you go through a scenario that you probably went through, at your meeting tables as to how this would work?
Well, our goal is that we avoid a major surge in our community. If there is a major surge in our community, that will not come as a surprise. I would anticipate, isolated cases here and there. This pandemic is not going anywhere anytime soon. So in my department, we're not planning for if, but when. And so whatever school might be impacted, whatever building might be impacted, our approach will be dependent upon the extent to which that school district undertook all of the guidance that they know about now. And so if everybody has been wearing their masks, if we can be sure that the individual who's positive has limited or even no exposures of risk to any other individual, that will greatly limit the extent to which we'll need to close things down or quarantine individuals. We'd like to try to quarantine the smallest unit as we possibly can. I think we're in a very different circumstance now as compared to March 13th, where we have a very good sense of the community prevalence. And we are much more adept now at testing and tracing and isolating. So I do think that it almost depends on what happens, but we're planning for when, not just if.
We'll take two more right here, and then I'll come over here, and then we'll thank you all.
Morning, one for introducing me. Has there been any discussion of widespread testing inside schools for students or teachers who will be in a closed environment, potentially, or at least part of the week? Has it even been a consideration?
What's that?
Not testing inside the schools, but we do have a protocol. We've worked very closely with Dr. Mendoza in terms of if there were to be an outbreak or an illness. There are isolation rooms in each of the school districts that a child or a person that may be ill that can be taken to. And then we would consult with our physicians. First our nurses that are all being trained and working through all of this, and in addition then with the Department of Health on it. Not prior to all screening will be taken care of. So there will be screening of staff before they come in. There will be that they have to come in before work, and there will be screening of students that they will do, that the families will do at home. And so with the symptoms on there, and if someone is symptom-free, they can come to work, they can come to school. If there is a particular symptom that somebody has, they need to stay home, they follow up with the school district, and then we would follow up with the worker or with the family.
Superintendent Meyer, I have a question for you. I appreciate Mr. Norwood's take on these questions being reserved for the superstars, but we have a superstar here. So, Superintendent, can you tell us what the plan that you're looking to submit to the state will look like, even just in broad strokes? What you're looking for the district in terms of reopening?
Sure. Actually, with all due respect, you'll find out at 6 when I present at our board meeting. I don't think it's appropriate to get ahead of the board. A good superintendent knows that. I'll be presenting that plan in its entirety. We'll have a PowerPoint that we can certainly send out, and the goal is to submit our plan tomorrow morning. So with all due respect, I'd like to reserve that till 6 tonight.
If there's not an opportunity to ask questions at 6 tonight, since it's a presentation,
Mm-hmm.
can you offer any thoughts on how big of a consideration space was?
That's absolutely. I'm a little stuck because, yes, that absolutely is what we quickly had to become physicists as far as the distance and the spacing and things of that nature. So we have very carefully, all of us as superintendents, partnering with others, have looked at what those guidelines are. So we have physically entered buildings and looked at how many desks need to be set up and how do they need to be appropriately spaced from one another. So absolutely. You're welcome.
I apologize, my friend. Our colleague had a burning question. You get the final question of
That's
the
okay.
afternoon.
Thank you very much for taking the time to talk with us today. Emily Putnam from Channel 10. A question for the task force. You know, we're seeing certainly there are differences in reopening plans from district to district, but one thing we're seeing across the board is the inclusion of masks, especially for in-person instruction. So my question is, you know, families are deeply concerned about kids complying with masks, especially younger kids. How are they going to be able to keep a mask on throughout the day? What kinds of solutions is the task force prepared to offer when it comes to helping students and staff address issues around masks? Anyone who wants to take it.
So it's a valid question. You know, the issue of the extent to which children, particularly younger children, will wear masks is to some degree an unknown. But I will say that we have a lot of experience already, you know, and our educators are not just teachers. They're role models, and they can motivate our students to do things that we never thought that they could do. And so in my experience, I've seen examples of nurses and educators working with students who are younger, working with students with special needs, and I guess I wouldn't underestimate the potential of what can happen with some good education. And so I am optimistic, and I understand that there will be hiccups along the road, but I do think that you know, with the proper messaging at home, with the proper role modeling as a community, I think we'll get through this. And I do think that our students will find a way to do this, because we have to. Because if we do not undertake these precautions, the alternative, unfortunately, is that we'll have to go backwards, and that's the last thing anybody wants to do.
And I think it was an excellent question that would allow me to close by saying that as much as there is concern with regard to the physical health of students, staff, and faculty, there are also concerns about the mental and emotional health of our school communities. This is challenging. And as challenging as it is for me at 55, as I proved here today, I expect it to be challenging for 5-year-olders. And so I think that the most important thing that we do as a community is what we have done to date. That we continue to understand there's not a simple answer and there's not a fixed answer, but that we will be required to adjust to meet the exigencies of what Paul Simon termed days of miracle and wonder, that require miraculous and wondrous people doing miraculous and wonderful things. And I thank the members of the task force. I thank my colleagues for being here, and I appreciate your help in helping us spread the news that this is a conversation that's bringing health and education together, to meet the needs of our times. Thank you very much and have a great afternoon.
Likewise.